Hi fellow future RNs. Today let's talk about the anti-TB medications, or also called your anti-tubercular drugs, and their important side effects and adverse effects. Let us first talk about a few facts about tuberculosis. Ang causative agent is called your Mycobacterium tuberculosis. Okay, and ang sakit na ito ay naipapasa, or the mode of transmission is through airborne. Okay, remember yung mnemonic natin para dun sa mga diseases that are airborne is your MTV. So that's for your measles, your TB, and your varicella. Ang bakteryang to, si Mycobacterium tuberculosis, usually ang ina-attack niya is yung ating lungs. Pero, pwede rin na i-attack ng bakterya na to ang iba pang parte ng ating katawan, such as your kidney, your spine, and your brain. Alam nyo ba na ang Pilipinas ay kasama sa top 4 na may mga pinakamadaming cases ng TB sa buong mundo? Okay, so that's 7% of the global total cases, according to the WHO in 2021. In fact, for every 100,000 Filipinos, merong estimated na 650 individuals ang infected ng TB. Again, this is from the data in 2021. Masasabi natin na ang TB is endemic talaga dito sa Pilipinas kasi ang TB laging nandyan, hindi siya nawawala. Lagi tayong may cases ng TB. Republic Act 10767, or your Comprehensive Tuberculosis Elimination Plan Act of 2016, is an act establishing a comprehensive Philippine plan of action to eliminate tuberculosis as a public health problem. Ang DOH naman ay merong program na tinatawag na National TB Control Program, or NTP, which aims to reduce mortality and incidence from tuberculosis in the country, and also to reduce catastrophic costs and provide patient-responsive health services. Okay, next. Alam niyo ba kung anong ibig sabihin ng DOTS sa TB DOTS? Okay, ang ibig sabihin pala niyan is your directly observed treatment short course. Meron tayong mga TB DOT center all throughout the country, and libre yung medications natin para sa patients with TB. Ang tuberculosis is a highly curable and preventable disease. Meron tayong mga vaccinations na available even sa newborn. Okay, and again, libre yung medications. Ang nakakasad lang, no, kasi meron pa rin talagang stigma, no, sa mga patients with TB. Kaya yung iba, nahihiya silang lumapit dito sa mga TB DOT center para makakuha ng mga libreng medications. Now, let's talk about the anti-TB meds and their common side effects and adverse effects. Okay, ang ating mnemonic is RIPES. R is for rifampicin, I is for isoniazid, P is for pyrazinamide, E for ethambutol, and S for streptomycin. First, we have rifampicin. Ang rifampicin din is also known as your rifampin. Ang rifampicin is hepatotoxic. So, toxic siya sa ating liver. So, educate natin ang ating patients na iwasan ng pag-iinom, no? Avoid alcoholic beverages, and also, if indicated, mag-monitor ng liver enzymes. Another important, no, na side effect or adverse effect ng rifampicin na pwede nating makita sa board exam, pwedeng itanong sa board exam is, tandaan mo, rifampicin R, ang pwedeng meron sa ating patient is red, orange, urine. Next is isoniazid. Isoniazid is also known as your INH. Okay, so para madali nating matandaan yung important side effects and adverse effects ng isoniazid, ilagay mo dyan INH. Okay, I is for iron accumulation. N is neuritis. Okay, ano yung neuritis na meron? Peripheral. Okay, kapag sinabi natin peripheral neuritis, ito yung nag-inflame, no, or nadadamage yung ating mga nerves on the peripheral areas of our body, which means ito yung mga nerves outside our brain and our spinal cord, so sa ating extremities. H is for hepatitis or hepatotoxic, kasi hepatotoxic din ang ating isoniazid. Next is pyrazinamide. Si pyrazinamide, palitan mo, gawin mong pyrazinamide. Why? Dahil ang important na side effect, adverse effect ng ating pyrazinamide is the increased or elevated level of your uric acid, also called as your hyperuricemia. Next is ethambutol. Okay, para sa ethambutol, tandaan mo ang E, which is also for your eyes. Dahil ang mga important side effects and adverse effect ay may kinalaman sa ating mata. First, pwedeng magkaroon ng color blindness. But the most important is ang ating patient ay pwedeng magkaroon ng optic neuritis or yung pag-inflamed or pagka-damage ng ating optic nerve. And lastly is our streptomycin. Ang ating streptomycin is nephrotoxic. So it is important na ma-monitor yung INO and also as prescribed, i-monitor ang creatinine levels. And also it is ototoxic. One of the interventions is to monitor for signs of vertigo and tinnitus or yung ringing sa ating ears. Other nursing care for patients who are taking yung ating anti-TB meds, to provide adequate rest, provide adequate nutrition to increase immunity, and of course, encourage yung drug compliance, no? Na i-complete yung treatment na prescribe sa kanila. That's all, fellow future RNs. I hope you learned something today. Bye!